Recording in progress.
Good afternoon, everybody. Welcome to the Montgomery County Economic Revitalization and Recovery Town Hall. These town halls have been established by County Executive Mark Elrich in order to give our business community direct access to county leadership and update information on all things COVID related, where we stand health-wise and what programs might be available for businesses out there. I'm Judy Stevenson. I'm the county's small business navigator, and I will be your host today. So I wanted to give you an update on some programs that are available or have just wrapped up. Oh, I also wanted to mention that this program is available to be interpreted into Spanish, and our interpreter, Miriam Lev, will be providing that. In order to access the interpretation, there's a globe icon at the bottom of your screen. If you'll click on that, you will switch to the interpreted version. And good morning, Dr. Bridgers. I see Dr. Bridgers has joined us today. I know his time is limited, so I'm going to go ahead and turn the platform over to you, Dr. Bridgers, so that you can give an update to everybody on our current state of health as it relates to COVID.
So good afternoon, everyone. And yes, my time is limited. We've been unpacking the CDC's recommendations for third shots using yet another vaccine, the Moderna vaccine, as well as boosters for those various aged populations since about 4 o'clock this morning, and after almost, it seems like immediately after the CDC's director, Dr. Walensky, overruled some of the CDC's ACIP recommendation. Mr. O'Donnell, I've asked him, who is our public health emergency preparedness and response manager, to join the call and give a crosswalk, since I have another call scheduled with the Maryland Department of Health officers around the same topic. But what we're doing is we are unpacking the vaccinations and the boosters. So simply put, the boosters, the third shots will be available for those individuals who are immune compromised. The vaccines that will be used for this cohort will be the Pfizer and the Moderna, and it will be at full dose. The other two categories, as we continue to unpack it based on my notes here, will be, I'm just going to categorize it, and CDC hasn't updated their definitions of underlying health conditions, medical conditions, or occupational conditions as of this morning. And so once we receive additional information regarding that, we will put together a series of information and press release for the public so they will know where and when we are administering the vaccinations. We will be administering those boosters Monday through Friday, as we've done before at our current sites, 9 to 7. We have the definition for those individuals who are age 65 and older and who received the Pfizer vaccination, and for those individuals who are age 18 years and older who have underlying medical condition, again, for those who have received the Pfizer vaccine. Now, Moderna and Johnson & Johnson are still submitting data to the Federal Drug Administration, Food and Drug Administration, regarding the efficacy of their vaccines for a second shot, booster shot for the Johnson & Johnson vaccine, and for a booster shot for the Moderna. Now, there are some questions around the data, and the efficacy is still high, but there may be some variation in the dosage. And so we do know that the Pfizer and the Moderna are at full dose. So that means that individuals now are eligible to receive a booster shot if they fall within one of those previously mentioned age categories, or categories where it would allow them if they have an underlying health condition. Individuals should check with their primary care providers regarding if they are eligible, if they have, especially if they are immunocompromised or have underlying health conditions, to make sure there's no contraindication for any medication that they may be taking. We are working earnestly with our minority health and community partners, our pharmacy partners, our hospital partners, and our provider partners to make sure, one, that they have the vaccine available, that they have access to the vaccine that is equitable, and that if they need any technical assistance around the guidance. Now, shifting briefly to our data trends, we are trending in a good direction. We haven't seen the levels of hospitalizations over the past 4 weeks. Our hospital utilization is low to moderate, meaning that we have available beds if there is a need for individuals who present in our emergency department for flu-like illnesses or COVID symptoms, in our ICU department, in our acute care settings, et cetera. And so we continue to monitor the data, plan for boosters, and then lastly, we continue to crafting our strategy to vaccinate our school-age populations. We know that data has not been formally submitted or reviewed that I'm aware of during this presentation, this town hall forum regarding vaccines for school-age kids who are between 5 to 11 years old. But we have worked and we continue to work collaboratively with our MCPS school systems and our independent school systems and our private school systems to look at strategies that are effective to keep our students in school. We realize that there may have been some initial challenges in our strategies regarding keeping our school age kids in class, but we have put together collaboratively with MCPS a robust point of care testing strategy where we identify those individuals who are symptomatic, and we're able to quarantine those individuals and keep those individuals who have not had a close contact or who have not been exposed in our classrooms. And as we look towards the horizon, deeper into the fall, I should say, in administering boosters, vaccinations in those settings. And so that's pretty much an update. Based on recall from this morning, from all the data and the literature that I've been reading, we continue to look at effective measures to keep our students, for example, our test to stay model that we've had conversations with the Maryland Department of Health and looking at a modified way to quarantine where we would administer to those students and parents who opt in a strategy on an interval schedule so that if there was a known exposure, we could keep them in class if they were not experiencing COVID-like symptoms or symptomatic. And so pretty much that's the update, public health update. Thank you for allowing me. I know it was a little more than 5 minutes, and there are a lot of things going on behind the scenes right now as we unpack the CDC's most recent authorizations and recommendations. And so we will provide additional updates on our Montgomery County COVID-19 portal. So stay tuned for additional updates later on today as these recommendations and authorizations evolve.
And you're still encouraging people to get tested. That's still a big
Absolutely. Absolutely. So let me just speak to that quickly. So over the past 6 weeks, we've actually increased our testing. So we started in early August, averaging about 1,000 tests per week at our community-led sites. We are actually testing folks up. The upper limit has been about 6,000 tests a week. Now that's great. It speaks to our trend line. It speaks to folks if they are feeling sick and are unvaccinated or even vaccinated, to know their status, to get tested. And so that keeps our community level transmission down. We maintain the lowest case rate and test positivity rate this week in the state of Maryland regarding that. And we can attribute that to the great help and support that we are receiving from our countyans to get tested, to again know their status, and if they are symptomatic or even asymptomatic, to be able to quarantine and get the follow-up contact tracing that's required accordingly. So thank you all for supporting that, for encouraging that, not only testing, but vaccinating. We are vaccinating, and we continue to vaccinate those individuals who are unvaccinated, to combat misinformation with scientific and data-related information, to keep folks informed regarding the efficacy of the vaccines, even the effectiveness and the need for a booster to combat any of the variant strands that we may see. The Delta variant is still the predominant variant of concern in the community. We continue to work with the Maryland Department of Health and other partners to monitor variants of concern, such as the Lambda and the Gamma and the Mu variant. And we haven't seen the number of cases. But what these booster shots will do, it will increase our immune response for those individuals who may have underlying health conditions or who may be seasoned, or I should say senior individuals whose immune system may have waned over the past 6 to 8 months.
Okay. Thank you, Dr. Bridgers. I'm wondering, Sean O'Donnell, are you on the call? Because I see another Dr. Bridgers, so I was just wondering.
That's probably Sean O'Donnell, because I sent him the link this morning saying, hey, I have another meeting and I may not be able to be able to be because of the time conflict. So Sean has been very gracious to support me. Prior to these operations, when Dr. Gales was the health officer and before I served now as the interim or acting, I participated in many of these town halls and forum. And so Mr. O'Donnell has been very much at the forefront of all we've done as far as our public health and emergency preparedness and response. And he's very apt at providing the update because he's actually the one to operationalize logistically and is at the forefront of the planning. And so I now have him participating and can walk through some of the slides. And these slides aren't draft because they have evolved since this morning and we've had the conversation, but he's able to walk through those slides now. So thank you for an opportunity to provide this update. Sean can walk through the presentation, and by all means, please stay safe. If you aren't vaccinated, please encourage folks to get vaccinated. Those public health practices that have got us thus far in a safe environment continue to be wearing masks or face covers in those spaces that are indoors and are tight and amongst individuals who may not live in your household. Continue to wash your hands for 20 seconds or more to eradicate any viruses that you may have touched upon in those high touch spaces, rails and doorknobs, etc. And again, continue to maintain those social distancing and physical distancing just as a safeguard. And I think that as we continue to deploy these safeguards, get vaccinated, to get more folks vaccinated, we will get through this. So thank you.
Thank you for being with us, Dr. Bridgers. I know how busy you are, so thank you. And Sean, if you have a few moments to provide a bit more, as Dr. Berger said, maybe on the logistics, we would certainly appreciate that.
Certainly, I'm happy to. I'm going to share some slides we have, which really shows the data a little bit more eloquently. And here we go.
Okay. Yep.
So, and can you still all see that?
Yep.
Okay. I'm going to go through some of the data rather quickly, largely because I think you all have been paying close attention to this in our county, but I'm happy to circle back if anyone has individual questions about any of this. From the standpoint of where we are with vaccinations, we have our CDC estimates for where we are, and that includes everybody in the county, includes our youngest members of our county who are not eligible to be vaccinated yet, those under 12. And I'm going to discuss in a few minutes of what we're going to do for that when they become eligible. But if you look to the right, you can see where we are with at least one dose or both doses. And of the eligible populations, that's the middle set of bars, everyone who is 12 and over, 88% are fully vaccinated. 97% have at least high numbers. Those are, in fact, the highest numbers in the country of any jurisdiction that is 300,000 residents or more. You can see of our most vulnerable populations, those over 65, those numbers are even more impressive. And then I just want to explain that the 12 to 17, we give estimates. It's a little bit harder for us to know exactly how many people are in each age group when we start splitting this up according to vaccine eligibility, because that's not how the census numbers track things. So we have to extrapolate a little bit, and that's why we get some estimates there. When we look at what's going on with transmission, you can see that we have had a rise of transmission really. And you see that over the last week or so, we've started to see those numbers come down just a little bit. We're hoping that that peak continues to come down. This is what it's looked like across the state and across much of the U.S. As the Delta variant really caused a rise in transmission and then a bit of a leveling off. And we hope that comes down. But again, we are a little bit at the mercy of how this disease works. We certainly know that our residents have protected themselves as much as possible with vaccinations. At least most of our residents have. When we, I'm going to fast forward through this just to again highlight where vaccinations have occurred and where we still would like to do some more vaccinations. A month or so back, much of our county map had areas of pink that needed more vaccinations. Really, we're starting to saturate most areas of the county. We still have a few neighborhoods where we would like to increase the vaccination level, and we work with our county partners at trying to get resources out to them. When we look at how there are down and identify, are there certain populations within the county that are less vaccinated or accessing vaccine at different rates? We did see some disparities for a while with some of our different ethnic populations. I know a lot of people considered that vaccine hesitancy, and I don't know if that's exactly the appropriate word because people use that for so many different things. But what we have seen is not that, but it took a while for certain groups to start having conversations about getting vaccine and deciding that they were ready to do it. And it was almost like once it started, there was a wave of support within those ethnic groups. And you see that our Asian and Pacific Islander groups hit that wave a little bit earlier than the other groups. Our Hispanic and Latino populations have certainly come out and been vaccinated in extremely high proportions. And our African American and Black populations are now within 2 percentage points of our white non-Hispanic residents. This is really saying across all walks of our ethnic and racial backgrounds, people are getting vaccinated. There's not a big disparity between groups coming out to be vaccinated. And when you see that, when you see the overall population, as we said, of eligible people is at 97% have a single vaccination, you can see why all these numbers are converging on that 88% fully vaccinated. There's a lot of information here. I just really want to focus over on the left side about vaccinated versus unvaccinated. If people look at what is known as breakthrough cases, vaccinated individuals who are still getting sick and in some cases being hospitalized, you'll see Montgomery County's numbers. We have a higher proportion of vaccinated individuals who are cases or who are hospitalized. When you look at those numbers, it's about 1/3. And I want to put that in context because 97% of our population is vaccinated. Of the people who this is spreading to, a much higher proportion of them are going to be amongst the vaccinated. When you look at what the actual risk is, though, that 6% of our population who's not yet vaccinated make up 54% of the cases, 65% of the hospitalizations. Your risk if you're unvaccinated is not double what your risk is if you're vaccinated. It's not triple. It's more than 12 times the risk if you're vaccinated. And in the case of hospitalizations, it's closer to 20 times the risk. So we're still emphasizing that even as we get very high levels, becoming vaccinated is very important. People's understanding of what herd immunity is. Herd immunity speaks to a level of vaccination within a community at which the spread of the disease begins to slow down. It doesn't mean that the unvaccinated are immune to the disease. It means that the continued spread has slowed down. those unvaccinated people are still, you see, even with our very high vaccination rates, those unvaccinated people are still becoming cases at an alarming rate and becoming hospitalized at a commensurate rate to the cases. So we do have concerns about that. When you look at the table in the middle, over the last 4 weeks, who's becoming hospitalized? You see that it's overwhelmingly our seniors who are becoming hospitalized. And amongst those who are vaccinated and being hospitalized, it's 80% of them are 50 and older. So it is the vast majority of people are those older populations who, again, do not have as a robust immune system as our younger populations do. And that goes a long way towards why the data showed that booster shots should be focused on these older populations. As far as what the county is providing through HHS and our partners, we continue to do a significant amount of testing. You can see on the lower graph that testing demand at our sites has gone up a bit each week. And if you look over at the left, you can see that while the county, across the county sites, we have between 5,000 and 6,000 tests a week that we're administering. Across all the county partners, that capacity has been around 40,000. So there's a huge capacity, we know, at the pharmacies, at the grocery stores, at private providers to do testing. Amongst vaccinations, they have certainly slowed after a huge number being done in the early to late spring. They've slowed, but they've been steady. We still had first doses coming in, and that's very important because, again, those are the people at risk. As far as where we are today with our positivity rates, that's what percentage of people who are tested come back positive, and case rates are showing up as a new case. And this gets measured by the CDC and our state partners over a certain span of days. So in this case, it's 7 days, so that we don't look at daily fluctuations. And then it's a rate of 100,000, so that you can compare large and small jurisdictions against each other to really understand what that transmission rate is. And you can see Montgomery County is doing quite well compared to the other counties in Maryland, but we still want to bring those rates down. That case rate is essential category according to CDC. The positivity rate is in the low category according to the CDC. So we have a lot of testing going on. We have low positivity rates amongst those being tested. It helps us find people. It helps those people to know they should be quarantined. But we are seeing still a significant or substantial case rate. We know that Montgomery County and Howard County are the two most vaccinated counties in the state, and it's not surprising that those are the two counties with significantly lower positivity rates and case rates. So just as an update, I know there's a lot of people interested in what's going on with booster shots, third doses. There have been meetings with our federal partners. On Wednesday, the FDA met. They made their recommendations for who should get a third dose booster shots. By the way, all of the conversations this week have been focused only on the Pfizer vaccine. That's the only vaccine that has submitted at this point enough data that the federal part a decision. Moderna has submitted data. We expect a decision to be made in the next several weeks on Moderna. J&J is submitting data. We expect a decision eventually to come on J&J. There are factors as far as how many people received those vaccines to date that allowed, honestly, more people have gotten Pfizer, so there's been more data to evaluate. And then Moderna and then J&J. But our federal partners will look at the data. They have enough data to safely recommend things. That's how we go through the process. The FDA made some recommendations. The CDC met yesterday. Their advisory committee on immunization practices met yesterday. They made some recommendations. They recommended adults older than 65 and residents of long-term care facilities should get the booster shot to protect them. That's where they saw the most changes in immunity. Adults aged 50 to 64 with underlying medical conditions that leave them at risk for severe COVID, and then adults 18 to 49 with underlying medical conditions based on their individual risk and benefit. Late last night, the director of CDC weighed in and added another category for those whose occupational risk also puts them at risk for severe COVID. So we do have that CDC, that bullet point. And then Maryland just pushed through their authorization and guidance this morning. So we have that as well. So what does that mean to the county? Already, individuals with compromised immune systems were eligible to get a third dose. If they got Pfizer or if they got Moderna, they can get a third dose. This is not a booster to their immune system. This is what is recommended to build an initial immunity. So they have been eligible, needs to be at least 20. We've been doing that at county sites. The private providers have been giving those as well. What's newly eligible are the following individuals. If they received Pfizer initially at their first and second dose, and they are 6 months out from their second dose, individuals age 65 and older may receive a booster shot. Individuals 18 and older who have certain underlying medical conditions, again, 6 months out, receive Pfizer beforehand. And then finally, individuals with the heightened occupational risk if they receive Pfizer and they're 6 months out. So those are who are eligible to get it. We are going to begin giving those at county sites. We anticipate that our private providers have, now that we've gotten the state authorization to do so. What we're going to ask of the public is that they bring their vaccine record or card. The first thing they need to do is if you think you're eligible, look at these criteria of the individuals. Make sure you receive Pfizer beforehand. We do have to check when you come in that you are getting the same vaccine. Make sure it's been 6 months since you received a second dose. If you did not receive a second dose of Pfizer, you're eligible to come in and get a second dose 21 days after your first dose. So that is what will happen when they show up. We'll ask to see their vaccine card, make sure they've got Pfizer, make sure it's been 6 months, and then determine by their ID, are they 65 and older, or do they attest that they have a medical condition or an occupational risk? We'll begin to message this out to the community immediately. We're working on our press releases right now. Again, this doesn't include individuals who received Moderna or J&J vaccine previously. We do expect to get guidance on that in the coming weeks. Where can people get the vaccine? Well, as opposed to when they got their first dose or their second dose, vaccine is widely available. Virtually every pharmacy, most grocery chains, they all have vaccine. Private providers now can order vaccine. I've heard already from colleagues that they've called up their private provider and they've been able to get a vaccination from them. You can go to the state site. We have a link to it on our webpage. You can go to the state search site. The CDC has a vaccine finder page, and you can see who's offering vaccine. I did a quick search about 11 miles around Rockville yesterday. I found 172 sites that have gone on and listed themselves. I don't think private providers have listed themselves. Some of our partners who do pop-up clinics, they don't list themselves. These are for static sites. So there's, in reality, probably a much wider group of people who have vaccine. Again, the county sites, we are gearing up to increase what we're doing to try to help meet that demand. But currently there is a huge number of private providers who provide these vaccines. It's always free of charge at all of these sites. They may collect insurance information, but there is no out-of-pocket fee for getting vaccinated anywhere. It should be anywhere in the United States. We're partnering, as we said, again, it's not only 65 and older, it's individuals who are in assisted living facilities. All of those facilities, I know many of you may have family members or friends who are in them. All of those facilities have been required for months to have a pharmacy provider agreement in place, and those pharmacies have been routinely providing vaccine and vaccination administration support to those facilities. We expect that that will continue to happen now that they become eligible for boosters. And we're working with our other congregate living or group homes or DDA homes and some other community partners to provide vaccinations at those sites. We're looking at expanding our county sites. Right now, we had shrunk the footprint of where we offered vaccine in order to allow, because our partners where we were doing it before, schools were back in session. Our rec department, who has been an amazing partner, helping us get vaccinations out to the community, they wanted to be able to do their senior programming, their after school programming, and their other community rec things, and we didn't want to interfere with those. So we scaled back where we were. Currently today, and probably for the next week or so, we'll continue to be at the Dennis Avenue Health Center, the Montgomery College in Rockville, and the Upcounty Regional Service Center. We're doing testing and vaccination at those sites. But we expect that with the booster guidance, we're going to need to increase our capacity. And we're now working on the facilities you see here. We want a presence in East County to be accessible to our residents who are on that side of the county. Montgomery College has agreed to let us come back to the Germantown campus, which has some very large space available there. You may remember we did mass vaccination operations out of that site previously. And again, we'll go back to Silver Spring Civic Building, where we vaccinated thousands of people back in the spring. We're looking at if we can move in a little bit earlier than October 11th, but right now that's the date we have agreement. A lot of these facilities have programming going on before then. And we know that no matter where we go, we're going to impact those partners' regularly scheduled activities. But it's very important that we provide this protection to our population with the boosters. We also did homebound and independent living vaccination clinics, and we will track on when those individuals are due and go back to those sites. Many of our partners in the community, our hospitals, our primary care coalition, our minority health partners, they also did all of these types of things. They have clinics going on every day. They did pop-ups for communities of need, and they are all committed to doing that, both to continue getting vaccine to those who are unvaccinated, as well as to doing the boosters. And then lastly, I just wanted to touch on pediatric vaccinations. I know the booster shots have sort of taken over the news the last few days. Pfizer has submitted their data to the federal partners to look at. They believe that they've shown that the vaccines are safe and effective for the 5 to 11. Those doses are a little bit different than adult doses. The federal government is being extremely cautious with rolling this out to kids because kids vary in size quite a bit, and they want to make sure that they're getting the right doses out to them. They also want to make sure that they've ruled out any sort of side effects that could put kids at risk. With that, they anticipate it's going to take still several more weeks to review the data and come up with a consensus agreement. They expect that those 5 to 11-year-olds may become eligible as early as mid-November. And then, of course, the younger groups, that data will be coming in as well. We also know that Moderna will be submitting information for pediatric doses, and we hope that they'll get approved as well. As far as our strategies go, our expanded hours, our expanded days that we're doing right now for booster shots are going to work for pediatric shots as well. We anticipate that parents will have to come with their children, particularly younger kids. Really are not going to tolerate a shot the way our older kids could without having their parents there. So for the sake of consent, for the sake of helping the younger kids get through this, we're going to need the parents to be on site with the kids, and that means we're going to have to operate in weekends and evenings. The big change from the last time we did this with the 12 to 15-year-olds is that our pediatricians are now eligible to receive vaccine directly from the manufacturers in the state or from the local health department if they want a smaller quantity. And we know that they really want to do this. They reached out to us last time, but they just didn't get that eligibility from the state until a few weeks after the kids were vaccinated. But they're definitely going to be on board. We're going to recommend people go to their pediatricians. you are certainly going to get a lot more attention from your pediatrician than you will at a mass vaccination site. So I know a lot of people will be more comfortable with that. But we did a huge number of pediatric vaccinations back in May, June, and July when they first became, I think it was June and July when they really first became eligible. And we're more than happy to provide those services along with our private partners. And of course, we will continue to coordinate with our school systems to get messaging out. Our school systems have been one of the most revelatory partners in convincing people to get vaccinated. A lot of times people just needed a trusted voice to say, yeah, you should get vaccinated. And when the schools started messaging out to their populations, we saw a surge of people come out for vaccinations. So we will, of course, want to do that again when we get to the next group. So that's the data I have to present to you. I wanted to not only share what's been going on, but also what we're planning to do, since a lot of this has been in the news and there's a lot of discussion about this and change going on. But I'm happy to answer any questions people have.
Sean, there are a couple questions. I don't know that you'll be able to answer them, but I'll put them out there, and if you can't, we'll get the answers. One is whether or not there are any emerging concerns with respect to fungal infections related to continued mask usage. Is that anything that you've heard of or aware of?
I have not heard anything on that. What I can say is I can tell you that we encourage people who are using cloth masks to wash them routinely. It doesn't have to be after every usage, but we do encourage them to wash them like any other item you wear regularly. And hopefully that will address, I would imagine that would address most bacterial or fungal concerns. If you have a strong concern, maybe recommend washing them with your whites and some bleach, maybe some color safe bleach, but that should help.
Okay. And then the other one is there any company that can do on-site rapid results testing, like getting results within 10 minutes?
So we are aware of some of the different rapid testing, and we've begun using them very recently in our public school system in an effort to get a quick idea of the kids who come into the school health room, whether with a symptom, whether or not that's COVID, because we really don't want to send home all their close contacts while we wait for a result. So we have been using them in that capacity. Those ones we're using are the Abbott Binax Now, similar to the ones that are sold over the counter for home use. And the difference is the ones we use are designed for clinicians to use and report to the state the results. But they work very similar to the over-the-counter ones. I'm not fully aware of all the rapid tests that are available over the counter or available through commercial sources, but I would recommend for small businesses to look into those types of things. And these are generally recommended for the asymptomatic screening of individuals. If your staff want to have high contact with the public and want to check they don't have symptoms and just want to be assured that they don't asymptomatically have COVID, those are good to use. If you have symptoms, we recommend you don't go into the workplace, and that if you want to confirm whether or not it's COVID, that you go to a site that's doing PCR testing for confirmatory testing, whether that's a county site or a private site, a pharmacy. And again, if you're symptomatic, I believe in most cases that insurance is covering the cost of those tests. And if you don't have insurance, I believe that most of these partners are covering the cost and being reimbursed by the federal government. I can't say 100%. You'll want to ask before you go, because I would hate for anyone to get charged for a test.
And then you may have alluded to this, but is there an opportunity for small businesses to buy rapid COVID tests for their staff?
Yeah, I think I'm not aware of the particular vendors who make those available to small businesses, We've been looking into, right now, we've been working with rapid tests that have been graciously provided by the Maryland Department of Health. They've been an amazing partner, and they've helped us keep kids in school. So I want to give them some credit for that. We're looking into purchasing some for the county for public health use. We use some with some of our partner agencies, again, to keep people safe in very specific areas. And we're looking into purchasing directly from Abbott. We do know there's a high demand for these, and the process we need to go through would be different than what a private business is able to go through.
Okay. Okay. Well, Sean, thank you so much for all that great information. I'm not sure what your thoughts are, whether we can send your presentation, your slide deck out after this meeting broadly, or if you feel like it'll be out of date so quickly, maybe they should just keep an eye on the web page.
Yeah, I would recommend the web page. In fact, this has changed 3 times this morning. It changed with every meeting yesterday. So we're at this point, we're not sending this out broadly for distribution because by the time I hit send, something will have changed, and I don't want. It's been very, very confusing as far as boosters go, and we're working really hard to try to cut through the confusion and be straightforward with with the public about what they need to know. And so again, we're gonna, that information will be on our website. I'm sure our public information team will share it multimedia ways, and there'll be people talking about it through the media. But again, you guys have been trusted partners. We wanted to let you know exactly where we are at the moment. Most of that data, the initial sets of data that you saw, they come in the Pulse report, and they are that is publicly available through the county's website. If you do a search for the Pulse report, we do publish it there, and so you'll be able to, if you wanted to look at where we are with it. It pulls from some of both the county dashboards, the state dashboards, the CDC dashboards. A lot of different people are tracking this information, and that Pulse report, our county stat team and our HHS team puts that together, and it saves me hours a day of trying to find this information. So I really appreciate that. They put it out weekly on Wednesdays.
Okay. Very good. Well, thank you so much for your time. Really appreciate it. There's been good feedback in the chat, thanking you for all this great information. And then just to be cognizant of time, I wanted to now turn to our Director of the Alcohol Beverage Services, Kathy Durbin, who's going to share with us some of what we learned through the pandemic, things that changes we made to operations and rules and regulations, and kind of what her ideas are as far as what it's going to look like going forward. So Kathy, thank you for being here. Appreciate your time. I know you have a presentation also, but welcome, and I'll turn it over to you.
Okay. Thank you, Judy. I really appreciate it, and I'm happy to be here. I was on many of these meetings in the past year and a half. They're very informative, and really grateful to you all for making them available to all of us. It's funny because when you talk about alcohol, and traditionally people say this is antiquated, this never moves, nothing happens, and I feel like we've all been moving at a great speed, and so this has been very important to share information. I'm going to try to share my screen as we speak here. Share screen.
And I have confirmed with Kathy that we will be able to send her presentation out after, and I'll also send you some links to the things we probably won't get to today. So go ahead, Kathy.
Okay, thank you. So this is, our piece, alcohol beverage services piece to the COVID experience. I think we could write many a book on the COVID experience. It's still it's continuing to occur, but I'm going to stay pretty high up here because there's a lot when you start thinking about and reviewing. You have to sit in a room with multiple people really to kind of figure out what happened the last year and a half and what continues to happen. I will say for businesses, as you all know, there were closures When COVID hit, quickly, especially the on-premise restaurant model had to close their doors except for takeout and carry out. People in the community were actually shut down. So we were very frozen in time at that point, and people were very concerned about going out and the spread, not knowing, what would happen if they did go out, or if, people, the fear of becoming ill. So the closures made us really kind of go into the mode of what can we do for the businesses. We were able to, through the National Alcohol Beverage Control System, we were able to work with them. They were giving the different jurisdictions dollars to help with any type of economic development. So we were able through them to put $10,000 into the economic development, some of the grant programs just to kind of kick it off. This is before we had trouble finding something actually at that point because it was very new to everybody. We were working closely with the on-premises to help them if they wanted to do the off-premise sales. When this happened, it was so quick, as many of you know. People didn't have the supplies to sell carry out drinks when that's not what they did. They didn't sell to go. They were only like a restaurant model. So as much as we could educate and try to figure it all out and work with our Board of Licensed Commissioners. So when we had the executive orders come down from the governor and then the local orders from the county executive as well, we created an online permit so that we would know who was asking and we could help them if they needed help, and they agreed to the certain things that whatever was named at that time with the carry out sales. So we had within 24 hours set this up. I think we approved at that point about 250 businesses within 24 hours. So it was really kind of exciting to see staff move in and everybody, IT move in, everybody just, I think everybody that's spoken so far from health side, if it wasn't for the partners, we wouldn't have been able to do this. So people could print out their own permit, and it was of course free. We also, it's hard to think that it was a year ago in August that we had the late night permit that when we started to reopen a little bit, we allowed late night sales through the executive order. So we had to figure out how do we permit people from 10 p.m. to midnight, and trying to extend those hours for the businesses. So we created lots of permits, which we usually don't do on the fly. It's something that has to go through Annapolis. And so like the businesses, we were also in new territory, but our Board of Licensed Commissioners was very supportive and everyone was very flexible. So it was fun to kind of get that different feel and have everybody pitch in. I think the outdoor areas are what have been the biggest changes in Montgomery County and everywhere, but especially Montgomery County. We're a very social county anyways. We like to do things outside. We like to have events, not necessarily always nighttime, daytime, lots of festivals. Before COVID hit, our one-day festivals and licensing were over 1,000 a year that were approved, and a few years before that it was 500. So it had really doubled in numbers and sizes, mainly due to businesses wanting to be part of the events, us changing our festival permit licensing to include the local businesses, and also there's so many local manufacturers that are also supporting the festivals and events, excuse me. So we also partnered with Visit Montgomery, was able to write a little bit of an award, again through NAPCA, to help support some of the restaurant week towards the end of the state of emergency, I would say, because we're still in it. So this is, I think, working with partners was the most important thing that we could do, and working with the businesses and trying to help them and assist as much as possible. So we did pivot. I know that word was used quite often last year and a half, but I was trying to think of what other word to use. We went to virtual training. We've done it before, but it wasn't as comprehensive as we would like, but we really did. We're able to investigate different ways to engage with our participants of training. Our alert training is the alcohol law, education, and regulatory training out of our licensing office, which is free to anyone who wants to ever participate. We have it in English and in Spanish. Now we can have it anywhere, anytime, because it's virtual. And, we can go to businesses, but of course, for safety reasons, we've continued to grow this virtual training. We also created a state certified training off of what we already trained the retail stores. So that's like a TIPS and a TAM and those types of trainings. But this is Montgomery County state certified training. More and more often we're seeing people who didn't think they would be in the hospitality industry are now in the hospitality industry. And I think we're going to see more of that with the shortage of staff and people trying to find people to work in their businesses. So this was really meant when we started it for those people that normally hospitality wasn't their main focus. For instance, even the theaters, they have people that are actors. They weren't trained in hospitality, even though they're wonderful people and they're very hospitable, but to understand the laws and the rules and regulations. And it's a state certification that's approved for 4 years. It's also mandated that license holders have somebody on premise at all times with this certification. So through this this mini grant, we received another one for this year. We will be able to train people for free. And so we were able to train hundreds of people with Alert and with the state certification. So the Alert's a little bit of a shorter snapshot. I would say the thing that was really the pivot was the Board of License Commissioners and regulation in general. We were also working in, really, we've always been partners with the health department, but we were in deep. I was part of, and still am part of the letter of approval team that met weekly, learned a lot about health issues and especially about this pandemic. And we were regulating mask mandates, capacity issues, things that we normally don't go to. Our partners would, and they would come to us. Tents, any kind of tent you could imagine, as most people probably remember, and will be like deja vu this year. Probably a lot of people will want to have outdoor areas. And we had and we still do have a Safety Alliance model that was from the Responsible Hospitality Institute that we implemented about 15 years ago to work with different agencies and departments around the county. We implemented that model with the health department and with emergency management, and actually visited all the businesses for those. We were short-staffed as well. There were a lot of people that because of illness or illness in their family or for one reason or another, we were a little short-staffed. But as a team, we could do it. We can go out to visit the businesses and help them and assist them with their questions. Also, the board took all the penalties and fines at that time and either waived them completely or cut them in half. So it was something they did on their part to try to help assist the businesses. For the most part, there weren't a lot of violations. It was more conversations. It was educational. It wasn't about penalizing people. So our warehouse went into action and worked with the suppliers and the local, it's funny when we think back on this because this was a scramble time, and worked with the local distilleries and helped keep them in business actually by, supplying. We had thousands and thousands and thousands of bottles of sanitizers that were made through the local distilleries. And I think some of the wineries might have gotten into the act as well, maybe breweries. But it was really quite interesting. They weren't selling the products that they thought they would sell. These restaurants were closed or kind of in limbo there. So they needed to make more product and they needed to stay alive. So this is one of the things that they were able to do, which really was a godsend. The hours changed at the warehouse. Deliveries still occurred, but we, of course, had probably half the staff that we would have had. And the ABS Communication Center actually went completely offsite. We'll probably stay offsite and virtual, but it was stronger than ever. The calls I hear them when I'm in the office, there's one ring, it's done, like they're on it, and it's, the hours are more varied now. And it really was interesting to see, even though we weren't delivering like we normally would, it wasn't as many businesses that were ordering product. I will say that the beer, when COVID hit, it was St. Patrick's Day week. So that was a big issue for everyone, the businesses, as well as the beer industry in general, because there were a lot of kegs that were returned. Everything just stopped that week before a lot of the events had occurred. So our retail stores stayed open. We had some limitations because of the executive orders for capacity limits. In the beginning, I would say any off-premise retail probably got slammed. People were afraid they were going to be stuck at home, and they were loading the pantries and purchasing products. So you really had a front end, this is going to last a month kind of feeling. People are going to stock up on their favorite wines and get what they need. So the stores were able to stay open. We did have 12 closures during the year due to positive testing. And that was 2 weeks of closures for the stores that had to. So it was very difficult. You never knew when that was going to happen. And at the time, of course, anybody that knew anybody that tested positive, it was, you were quarantined. So we had to, like many of the businesses still do, have to recognize that there are still mask mandates in certain areas. And how do you police that and not make it, we actually had a store manager who, a gentleman broke his nose in a fist fight because he didn't want to put a mask on. So it was very confrontational, especially in the beginning when it was new to a lot of people. So keeping our stores clean and safe was very important. I will say the local manufacturers, we did a couple of webinars during the heat of the state of emergency, and the webinars were quite interesting, and talking to local manufacturers to hear their story, how they stayed alive. And many of them were quite grateful to our stores because they were able to put products in our stores and people were shopping in our stores where normally, you can't hit the 26 stores at once. So it was really a blessing for them in many respects to keep them in business and help them go, stay in business during this time. So that was a really great, I think, stop and look and think of that moment of how we can be even more of a resource to the community at large. So supply chain issues, we're seeing it everywhere. I need a new car. There are new cars. Don't tell my car that, but I do need a new car. But it is, everywhere you go, you're going to see those issues. Starbucks, any coffee shops, any of those types of things, you're going to see it and you're going to hear about it. And it is happening now. It's nationwide. So staffing, product, alcohol products being maybe shipped over. If it's a product from another country or some of the materials from another country, they're stuck in ports. Nobody can drive them to their destination. There's a glass shortage. Apparently Coors Light can't find brown bottles. It's really interesting to see how this is playing out. Luckily, there's a lot of different types of products, and we are able to have other options for people where years ago it wasn't so much. If a customer goes onto our iStore at ABS to order, a license holder, they will see what other people are ordering like orders. So if we don't have it because there's a supply chain issue, hopefully we will get it soon. But I know the suppliers have been working really hard and we've been meeting with them quite often. And so is a lot of the other wholesalers around the state. So we're working hard to try to get those products and more into the hands of the license holders, the businesses, and whatever we can do to help. It's looking a little better for some of them, but that glass shortage is, I think, really hurting, and the staffing. There are no truck drivers. It's been very difficult to have licensed people. I just saw on TV last night that they were thinking about having nurses graduate early because they need nurses. So it's going to be us helping to train these people that come back in and try to hit these jobs. And hopefully we can be a resource. So just quickly, there's been a lot of legislation flying around and a lot of conversations last year. I was really surprised at some of the conversations on the state level because everybody was in the middle of a pandemic. But one of them was relevant is SB 205, which was the carry-out cocktails in the state of Maryland. And this allowed the local jurisdiction, the Board of Licensed Commissioners, there's 25 boards in the state, to, if they decided to continue to carry out after this, following the state of emergency, they could sell by the drink, allow the businesses to sell by the drink. So our board, of course, did allow it, and we do have it on our website. We have about a little over 400 businesses that applied for the permit during COVID. After the state of emergency, when we send it back out, we have probably it's around 125 businesses now. So about a quarter of the businesses are still interested in buy the drink. Those that have it either just have it because they're waiting for the other shoe to drop and they're afraid we're going to have another closure, or it's very important to them. So I don't want to belittle, I don't want to say that because it's less people, it's not important. To those people that have made it work and that it's worked for them and they do it in a productive way and it's helped their business, it's very important. And this is something that the Alcohol and Tobacco Commission on the state level, part of that bill was that they would survey, collect data, research, see how this is impacting our state, especially for health and some of the alcohol permissions that have occurred. This is a sunset provision in 2023. We haven't seen a lot of issues, but there hasn't been a lot of follow-up. We are doing carry-out surveys right now to the businesses. So our outreach team is speaking with the businesses, and it's been very interesting to hear their story. And like I said, for some of them, it's really working. During COVID, you could take your drink as a consumer and walk anywhere you want to. When the state of emergency ended, that became open containers. So in essence, you're selling that drink, and it should go home. It should go to a destination place that's allowed, alcohol is allowed. So it's not an open container because we have those laws. I will say that the streetery model was quite popular because of the carry-out cocktails. We have a marketplace license that we created about a year before COVID hit, and it was really sexy and really out there. And we thought, oh yeah, this is so people can carry their drinks around. Oh no! And here it's something that a lot of areas are interested in. This year we're going to massage that license just a little bit to allow the district managers to apply if they like, so that if like Bethesda Urban Partnership or another entity would like to apply for that marketplace license, they could, and that would allow the businesses in the area to sell, and then they can come to this area. So I don't know how many of those, it's a lot of work, it's accountability, but they've been doing it and doing it well for the most part. The other bill that was important to us was HB 428, and that was a renewal bill for renewal of alcohol licensing for the businesses. We did not renew licenses for a year, so it was a 2-year license renewal this year. The fees were waived. Most of the fees were waived. It was different for the type of license. It was a delegate Lukey bill, and we worked with them on this bill, and I think it was as fair as it could be. And so some of the fees were waived. Late fees were waived. Some of the renewal fees were waived, and some of the, depending on what type of license you had, it was waived or partially waived. So everyone received a separate invoice this year. It was, we have 1,100 licensed facilities, and so we had to do them all really by hand. But because it was so different, it's usually kind of like whatever your license type is. The fiscal impact on our, on the LRE division was 1.5 million, but I think it really helped some of the businesses and took some more of the pressure off as they tried to reopen, and they're still trying to reopen. So hopefully we can continue to help and be, as much of a partner as possible for the businesses. So we're open for business. Our lobby hours are open. We do have curbside pickup at our warehouse 2 days a week. We're trying to make it 3 days a week. We do have some limited staffing still trying to get some staff in. So we're opening slowly but surely, but our lobby is open from 9 to 5. Communication center, you can call anytime. iStore ordering 24 hours. Email, I put my email on here as well. Feel free to email me. I think one of the biggest changes we've seen is instead of waiting for people to call us and complain or have a problem, we're going to outreach. So as much as we can grow the outreach for our department and help the businesses stay in business and be a resource to the business, that's what we want to do. I've been director all of 4 months, and I'm very excited about working with the businesses and closely with the businesses. So like I said, that's very high level. There's lots of stuff, a little, if you dig a little deeper, but always happy to have those conversations. So,
so you've been director for 4 months, but how long have you been with the department?
I've been with the department 19 years.
So you are the resident expert.
Well, I don't know about that. I think it's, with jack of all trades, but it is, it's a different perspective. I've been an alcohol regulator for 15 years before that. Then I was the community outreach manager, created both of those positions. So it was really fun to kind of be a pioneer in some respects in the county. First woman director in this position. So happy about that. And I was in business. I worked ran a business in Bethesda for many years, and also worked as the executive director of the Montgomery County Restaurant Association back in the 80s. So it's been really fun to really see all those perspectives.
You've done a tremendous amount of great work, Kathy. Thank you so much.
Thank you.
So I want to be respectful of everyone's time. Apologies, we've run a little bit over, but my goodness, what a bunch of great information was shared today. The next town hall will be October 8th, so look out for information on that. Again, Kathy, thank you for being here. Thanks for everybody who participated. If you have questions, please follow up after, and we will send out a follow-up email with Kathy's presentation and some other links that you might find helpful. So thank you all so much, and have a great weekend. Bye-bye.